I'm excited to be here with Sam from RoundTrip. Really eager to learn more about your solution, what is new, your role, what you're seeing in your work with your customers. And so we're ready to dive right in. Let's start with some introductions. Sam, tell us a little bit about you, your role at RoundTrip. What are you doing there, and how long have you been there?
Yeah, absolutely. So RoundTrip was founded in 2016.
Sure.
I joined the company in 2019, initially in an operations role. So I was the COO here for a number of years. And then at the start of this year, I took over as CEO. So I'm excited to be at the helm now. Um,
Congratulations.
yeah. So before RoundTrip, I spent my whole career in healthcare, initially in consulting, which gave me a really cool opportunity to work across pretty much all the healthcare sectors. So I've seen plans, I've seen providers, I've seen pharma and life sciences, I've seen healthcare tech. And so having seen all this stuff through different lenses, I kind of now am really excited to be at RoundTrip, bringing kind of my background in engineering and data, and working firsthand with our customers to really use that tech and data to better align the incentives across the industry, and drive better health outcomes.
Well, congratulations, and sounds like a really well-rounded background you've been to this role. So I always start with why, right? Like, why are we doing this? What is the problem you're looking to solve? So tell us a little bit about what is RoundTrip looking to solve? Why are these problems important, and why are they important now?
Yeah. So at the highest level, we're on a mission to remove transportation as a barrier to health and well-being. So transportation is actually the third leading barrier to healthcare in the US, which I think gets a decent amount of attention. It falls into the social determinants of health bucket. But to make that a little bit more tangible, like really why and why now? So if anyone's ever run into issues getting a patient discharged on time, they definitely know how painful it is to actually secure patient transportation. This is an issue, obviously, for patients and for their health, but it's a huge operational headache for providers too. And so if we kind of look at what the trends are in the healthcare space over the past decade and what we're expecting in the decade ahead, it's really kind of answering the question of why now. So if you think about first outpatient appointments,
Yeah.
so over the past decade, outpatient appointments have had a median no-show rate of 7%, which
Mhm.
means patients not getting the care that they need, and obviously clinics and providers not being able to actually kind of manage their reimbursements and revenues accordingly as well. The projection for the next decade, as we see baby boomers aging, is for outpatient and clinic volume to actually grow between 15 and 20%.
Right.
So that already off the bat is like, in this outpatient scenario, we've got this big opportunity that if the third leading barrier to care is transportation, how do we start to tackle that, knowing that the volume here is only going to grow? And then it compounds.
Mm.
So the patients who miss their outpatient appointments are obviously more likely to end up in the ED.
So,
And over the last decade, ED volume has increased 4%, and it's expected to increase another 4% in the coming decade. Um, and so then you're like, all right, I think many of us have had an experience of going to an ED, waiting a while to be seen, potentially waiting a while to kind of get a place to go sit or a bed. And so these ED waiting rooms can get backed up when patients are waiting to be admitted actually inpatient in the hospital. And bed availability inpatient can be limited because transportation may be delayed in actually getting current inpatients out of the hospital. So there's really big delays in bed turnover that can happen strictly just from transportation. And when we look at the trends, we're seeing that inpatient volume and length of stay are projected to increase in the next decade, by about maybe 10% or so. And so if we look at kind of this thread of transportation that touches all of the care settings of healthcare, it's really clear that a transportation solution to just better streamline and coordinate things, across all of these different healthcare settings is really, really important right now.
so interesting. I love the way you describe the impact across multiple care settings. A question for you: do you see this issue of transportation as a barrier similarly across different settings, like rural, urban? And also, is it more for some demographics, say older adults, vulnerable populations? Give us a sense of where you see more acute issues versus more general.
Yeah, so in the outpatient scenario, more socioeconomically depressed, older adults, more vulnerable populations tend to be disproportionately impacted from an outpatient perspective. And to your point about geography, even in an urban setting where folks think, hey, you could just stand on a street corner and hail a cab, this is still an issue. So rural versus urban, the issue persists. Once you get to those higher levels of care, like discharging someone from inpatient, actually it could be any age, kind of any geography, and that issue persists, and it's kind of cross-cutting.
So interesting. So I know you have some slides to show when you tell us about your solution. Maybe we can go there because we're eager to hear how RoundTrip solves some of those problems.
Yeah, absolutely. Let me pull them up. Okay.
Yeah, you can see it.
Great. So as I mentioned, we're on a mission to remove transportation as a barrier to health and well-being. So ultimately, what is it that we're doing here? We're focused on a couple of different use cases. So RoundTrip at our core, we're a software platform that's enabling healthcare staff to coordinate any level of medical transportation across all payer types. I'll talk about the use cases first and then kind of how we tackle them. So the first one, of course, is outpatient appointments. So reducing no-shows by making sure that transportation is really not a barrier for folks. And when we talk about outpatient appointments, these can be facility-sponsored transports, like a facility paying, 10 or 15 bucks to put someone in a ride share. But we can also tap into insurance benefits that patients already have, but might be having a hard time figuring out how to navigate or leverage. The next use case is for inpatient and ED care coordination. And so the real focus here is reducing length of stay and improving patient throughput. So that scenario that I was talking about, where you've got someone waiting in the ED because you've got no beds available inpatient. This is how do we really empower our care teams to operate at the top of their license. In the inpatient setting, care coordinators may spend 20 minutes or more scheduling transports by phone. And in that scenario, that would be 20 minutes that they can't spend actually doing direct patient care or doing advanced care planning or other things that are super important for patients. And again, this gives folks in these roles the access to every vehicle type, every payer type through a single pane of glass. And then the last use case that we look at is for transfer centers and central dispatch. So this is a trend that we see growing in the provider space where health systems are putting together, whether they call it an operations center or a transfer center, to really be almost like the eye in the sky of what's going on across departments and facilities. And so this ends up being a really pivotal tool to help these teams understand the physical transportation and movement of patients, whether it be inter-facility transports from kind of a rural clinic into the mothership, or discharges to post-acute care or skilled nursing and that sort of stuff.
Makes a lot of sense. Yeah, we in our work with health systems too, so much effort is going into building that command center of the future. With transitions of care and getting people discharged appropriately to improve, the big metrics are on throughput and capacity and so on as well.
Totally. Yeah. So now a little bit like, how is it that we're actually doing this? So we do not own vehicles or employ drivers. We don't consider ourselves to be a transportation company. We're a software company with wraparound services. And the way we think about it is really meeting users where they are. So within the health system, making sure that we're clinically integrated with the places where people are working every day. So that means the EHR, care transition platforms, maybe some of their communications or notification platforms. And so we're able to pull key patient information directly from these platforms and make it super easy to schedule a transport in a matter of minutes. And make sure that it's done in a really compliant way, that we're documenting medical necessity and getting all the paperwork that we need in order to make sure that insurance can pay for as many of these transports as possible. since we don't have vehicles or drivers, we instead actually curate a network of the healthcare transportation providers in each customer's geography.
Sure.
And then they have the ability on the right-hand side of this slide to actually electronically accept the transport requests. At the same time, they'll get digital information of everything that's needed to make sure that the patients can be transported safely, any kind of clinical things that they might need to know as the patient's being moved, and then, of course, all the info that they need to be able to bill insurance. So this is saving the dispatch teams on the transport side quite a bit of time and phone calls and faxes and loose papers that get kind of lost in the shuffle, making it really streamlined end to end. And so we try our best to be integrated with those transport companies as well. So the dispatch systems that they're working in, they're able to pull all that data directly in and get that information. And then kind of in the middle here, we've got our like round trip secret sauce, if you will. So we create data and insight and apply business rules around the transportation process, make sure that we're monitoring performance, and then partner with customers to drive improvement, strategic relationships, and more from there.
Very helpful. Are there, when you think about the solution that you built, and congratulations on doing this, what is the alternative for a health system who wants to do this? Is it just as you said, the paperwork and the regular dispatch workers managing that, or are there competitors that you see, or is it working directly with the Ubers and Lyfts of the world? Like what is alternative and what makes your solution different?
Yeah, so talking a little bit about that, there's a number of different approaches that a customer might take to try to tackle this problem. It's not uncommon, even in 2024, for us to go in and start working with a customer and their current workflow and process is just making phone calls. So they've got maybe a list of transport companies taped to the wall when someone needs to be moved. They pick up the phone and it's almost like a phone tree, right? They dial down the list and they look for someone who can move the patient in a timely manner at a good cost. And so there's always the alternative that's sort of like do nothing, right?
Yeah.
So that's one alternative. Certainly there are hospitals that are working with Uber or Lyft directly. And that provides really good access to rideshare as an option. But as you start looking at patients who might need an ambulance level of transport or maybe that more specialized care, then you're kind of back in this scenario where, hey, we can get an Uber or a Lyft for these ambulatory patients, but we're still kind of playing that phone tree game when it comes to trying to move these more complex patients. And then, of course, there's other folks that are doing tech-enabled transportation workflows in the space. The way that we position ourselves in the market is we are totally agnostic to transportation vendor, to EHR, and to region. So, you had asked earlier about like rural versus urban versus suburban. We've got clients that cover all of those. The complexities of transportation tend to vary a little bit in each of those areas, but in every single part of the country, transportation is a huge need. Ultimately what we're doing is making sure that we are collecting data about the transportation needs and the performance in a really unbiased way, which is something that the phone call process just doesn't have. Oftentimes we talk to customers and we'll say, how many transports do you do per month or per week or per day? And they just have no idea because there's nothing that is acting as a system of record there. The other piece I'd say that's pretty neat is that we're able to enforce the contracts that a health system has in place already. So we're not entering the market and saying, we're going to install a preferred transportation partner, or we're going to kind of get in the way of the relationships that staff have spent probably years, if not decades, forming. Yeah. So what we say is help us understand the relationships you have. Are there providers that get first right of refusal? Are there certain performance metrics or ways that you want transportation to kind of flow into and out of your hospital? And then we configure the product to match that. So we're really able to help make sure that we like honor those existing relationships as opposed to like really upsetting kind of the status quo when we first come in. Yeah. I mentioned compared to Uber and Lyft, we offer every single level of ground transportation. So from a user perspective, it's really straightforward to be able to launch RoundTrip from your EHR, get patient data pulled over automatically, and then choose any level of transport you need and monitor any patient's transport in one place, as opposed to having this kind of like disjointed process all over the place. And then the other thing I'd say is, I said we were software with kind of like wraparound services. And I will continue to kind of stand on this soapbox and say, like, pure SaaS or pure software in healthcare just doesn't exist. So if you don't have the services to really make it effective, it's going to be a really tough adoption to drive. So we're really invested in partnering with customers to drive their success, helping them assess how well their current transportation program is performing, help support them in advancing that journey, designing new workflows and driving change management for users during implementation, reviewing data and reporting, knowing that that's new information that they're getting that they didn't have before. It can be really overwhelming. And so we kind of handhold through that process. We do authorizations for insurance on behalf of customers, and then we're able to provide a consolidated invoice, which for folks who work closely with transportation, you probably know that it's like a scrapbooking exercise sometimes at the end of a stack of invoices, and you're trying to reconcile it against
all together. Yeah.
record, and so we can consolidate all of that.
Gosh, got it. So those are some of the wraparound services that you mentioned. Very, very cool. How long does it take to get RoundTrip up and running? Say I'm a health system, love the concept, I want to get it up and running for the system or for a single site. What does it look like?
Yeah, so for a system, once you kind of get through the hurdles of contracting and legal and compliance and all that fun stuff, we've launched clients with integrations in as little as a month. In other scenarios, we've had a backlog of IT projects within a health system that we're kind of standing in line, and that could take a little bit longer. But I'd say best case scenario is usually maybe like 4 to 8 weeks to get people fully launched and trained and ready to go with an integrated experience.
Pretty quick. And then can you share any specific results, KPIs, ROI that you have seen with your customers to date?
Yeah, totally. So pulling up one of our, I'd say like banner case studies is St. Luke's University Health Network in the Lehigh Valley. They have an internal fleet. So think of them sort of like a transfer center or command center use case. They've got their own ambulances, but they're kind of handling transportation across the board. And of course, their fleet can't handle every single transport that's needed. So what they were looking at when they evaluated adding RoundTrip is they were going to have to add a significant number of staff in order to accommodate just the increase in demand for transport. In implementing RoundTrip, they had an 86% reduction in calls coming into their dispatch center. It's actually really crazy. You visit their dispatch center and like you could hear a pin drop. It's like a library. It's really neat to see. Their patient throughput has improved really significantly. Transports are actually being fulfilled in a more timely manner. And the number of folks on the patient side who are being stuck in the hospital longer because of transportation delays has decreased really significantly. So an estimated $720,000 in annual savings just from moving patients more timely. So a really huge win from an ROI perspective there. A couple other kind of key stats to call out, just thinking about the pure inpatient situation. We worked with a health system in Vermont that had like no process at all. So care coordinators were finding themselves negotiating timing and rates in real time, trying to get patients moved. So we were able to implement really quickly and redirect more than 3,000 hours a year of staff time from this kind of negotiation and transportation coordination activity to direct patient care. And at the same time, we're securing transports for them 10 times faster and saving them money because people are moving faster.
This is so helpful. Thank you for sharing some of these specifics, and these numbers are not trivial. What I also appreciate about this is that sometimes with digital solutions in health systems is an attribution question of like, yes, I did this digital, but can I really attribute that value to this? I think the attribution is so much clearer with your setup because you can tie it directly to transportation. And then you have these additional wraparound services like the authorization, all these pieces that you are saving hours of that team and, enabling better workforce flexibility as well with that. So I think it's a more round solution with more direct ROI. So congratulations on all of that.
Thanks. Yeah, we're excited. Attribution, you're right, is a really difficult thing to kind of crack in the healthcare space. We're so incredibly lucky to have customers that kind of help us parse through the data and make sure that we're fairly representing the impact that we're having.
That's right. Well, I appreciate our time together. Anything else that you'd like to share about anything that's coming up with RoundTrip or anything new that you want people to know of?
Yeah, so I think something we run into a lot is we talk to folks who are like, yes, transportation is such a challenge for us, but they just don't even really know where to begin to tackle it. So I would say check out our website. We have some good resources online. The transportation blueprint specifically kind of walks through step by step how to build a transportation strategy for your organization. We have an ebook on transportation networks to help folks think about how to manage the relationships with the transportation providers in their area. And then upcoming, we're going to be having a webinar around transportation strategy maturity. So as you start to work on that strategy and understand your network, where do you kind of fall on maturity and what is the art of the possible and what's actually really necessary for a health system to work well? And then I think at the start of next year, look out for us. We'll be at a number of the ACMA conferences and we'd love to say hi.
Well, that's amazing. And I'm on your website right now and I see a lot of these resources which look really good. I'm going to go and look at some of these myself. But Sam, thank you for your time. Great to learn more about RoundTrip and eager to see what's coming next as you continue to grow. Thanks again.
Thank you so much.
Bye.